that are moving the different components of the larynx. So these will be the different views we will be seeing. We'll be talking about the muscles as we see from them back, and we will be talking about the outside and the inside. Let's go through them one by one. The transverse arytenoid muscles. These are the muscles, as the name indicates, they are running between the two arytenoids transversely. They are attached to the posterior surface of the arytenoids, and when they contract, they bring the two arytenoid cartilages together. They help in the sliding movement. I will remove myself from this point. I can actually move myself here. Okay, so arytenoid cartilages, the sliding movement we talked about of the arytenoid cartilages. Arytenoid cartilages can slide away or towards one another on the top of cricoid cartilages. So moving them together close to one another, it is done by the transverse arytenoid cartilages. And when it does that, it is actually directly closing the glottis. So it is the help that is adducting the vocal cords, bringing the vocal cords together to one another, and it is closing the glottis. The oblique arytenoid, these are the ones that are running here in this direction and this direction. They are running in the crisscross fashion, and from the muscular process of the arytenoid cartilage of one side to the apex of the arytenoid cartilage on the other side. These are pictures from the Grays, and these are pictures from the Grant's atlas. So these are doing the same function. They are bringing them closer to one another, closing the glottis, and working as the adductor of the vocal cords. The thing that you have to look at it right here, this muscle is extending beyond the arytenoid cartilages. So this part that goes beyond the arytenoid cartilage is parallel to the aryepiglottic fold that is known as aryepiglottic part of the oblique arytenoid muscle. We will look at it shortly. It is basically the continuation of oblique arytenoid, and it, as it you can see, if it goes through the aryepiglottic fold, when it contracts, it will become straightened. When it will be straightened, so in short, it is narrowing the laryngeal inlet. It is the narrowing, it helps in narrowing the laryngeal inlet. It approximates the aryepiglottic folds. We have talked about the posterior. Now with the next is posterior cricoarytenoid. The name shows that it is attaching from the cricoid to the arytenoid cartilage. Its origin is from the posterior aspect of the cricoid cartilage. Its insertion is on the muscular process, the lateral process, this one, of the cricoid cartilage. When it contracts, the arytenoids along the vertical axis, they tilt like this. These are the movements we talked about earlier. So it helps rotate the arytenoid on the vertical axis. The vertical axis is shown by this red dot right here, and it twists like this. The anterior vocal processes, they go laterally, and the muscular process, as they're called, the anterior vocal processes, they go laterally, and we are doing now the abduction of the vocal cords, and it is leading to the opening of the vocal cords, opening of the glottis in a diamond shape. It is leading to the opening of the glottis in a diamond shape. So this is the posterior cricoarytenoid muscle, and this is the only muscle. That's the very important point. This is the only muscle that abducts the vocal cord. This abducts the vocal cord, that opens up the airway, and anything if it happens to this particular muscle, you are left with adducted vocal cords, and that is blockade of the pathway. Lateral cricoarytenoid are just doing the opposite. They are shown right here. They are arising from the cricoid cartilage of the lamina of the of the arch of the cricoid cartilage, and they are inserting on the muscular process. So this muscle, the previous one that we talked about, was approaching the muscular process from the back and pulling the muscular process back, and the articular process is laterally abducting. In the meanwhile, this is exactly opposite. It is approaching the muscular process from the front. So it, as it pulls the muscular process front, the vocal process, it goes medially. It closes the diamond. It will rotate the vocal process, vocal cord near one another. It will rotate the arytenoid cartilage along the vertical axis and it will close the glottis. It is an adductor of the vocal cord. Then we are left with thyroarytenoid. It is starting from the thyroid cartilage and it is inserting in the arytenoid cartilage. So it is basically reducing the distance between the two. Here it is shown. It is basically running. It is basically running on the roughly parallel to the cricovocal ligament, cricovocal membrane, and the uppermost part of this thyroarytenoid muscle is known as Vocalis muscle. So it is running between the thyroid cartilage in front and the arytenoid cartilage in the back, and the topmost process where it is attached to the thyroid cartilage here and the arytenoid cartilage here, it is the Vocalis muscle. So when it contracts, it reduces the distance between the thyroid cartilage in front and the arytenoid cartilage in the back. In the meanwhile, it is relieving the tension from the vocal cord. You can see here, it is attaching to the thyroid cartilage in front and arytenoid cartilage in the back, and when it is contracting, it will reduce the distance between the two, meanwhile reducing the tension of the vocal cord. So this is vocalis muscle. This is the vocalis part that is purely parallel to the vocal cord, and then there is a part that is expanded up along the aryepiglottic fold and along the aryepiglottic fold that goes to the this free margin. This part is more better known as thyroepiglottic part of the this muscle, sometimes known as a separate muscle, thyroepiglottic muscle. It is attaching to the aryepiglottic fold and they will pull the aryepiglottic fold towards the thyroid cartilage. In other words, it will be opening the laryngeal inlet. It will be getting the thyroid cartilage laterally. As you can see, the running of all these fibers is across this saccule, the middle cavity. When these muscles contract, the saccule is compressed and the secretions that have been produced to them, they go and supply over the vocal cords. This brings us to the thyrocricothyroid muscle. The names indicate it is originating from the cricoid cartilage below and it is attaching to the thyroid cartilage above. When it contracts, it helps tilt the thyroid cartilage in front. So the dotted line was the previous position, the solid line is the new position. It tilts the thyroid cartilage to the front, and as it tilts, the vocal cords are stretched. The vocal cords are stretched, the vocal cords are thin, and you're able to thin your voice. You can see when you're talking, you can actually make your voice thinner. When you're making your voice thinner, what you're doing is you're pulling the thyroid cartilage in front, increasing the distance of the anterior angle from the arytenoid cartilage, increasing the tension on the vocal cords. So that's it. That's all the functions of all the muscles of the vocal cords. I have been using the pictures from the Grays and the Grant's Atlas. The one that were on the top were from the Grays, the one on the bottom were the Grants, and the and this picture, this set of muscles, this picture is from the Netter's Atlas, and this table from the top, it is from the Snell's Atlas. All the muscles, origin, insertion, and functions are discussed. And the one thing that you can see, there is only one nerve muscle that has a different set of nerve, that is the external laryngeal nerve. All the rest of them are supplied by the all the rest of them are supplied by the recurrent laryngeal nerve. So let's get back to it. So these are the summary slides again from the Snell's. So these are talking about the elevators of the larynx, the pressure of the larynx. The elevators include all the suprahead muscles, and among the infrahead muscles, the thyroid muscles, the digastric, stylohead, mylohyoid, gynoid, and the elevators of the pharynx include elevate the larynx indirectly. Stylopharynges, salpingopharynges, palatopharynges. You will see them in the pharynx lectures. And the depressor includes 3 out of the 4 infrahead muscles. These are the sternohyoid, sternothyroid, and the omohyoid muscle. When talking about the narrowing of the inlet, we have talked about this extensions of the oblique part of thyroarytenoid, aryepiglottic part. This is the one that is responsible for narrowing of the inlet. For extension of the inlet, we were talking about this muscle, the thyroepiglottic part of the thyroarytenoid muscle. For the vocal cords, we talked about the tension and relaxation. The tension was due to this muscle, cricothyroid, moving the thyroid cartilage anteriorly. The relaxation was due to this muscle, the vocalis, that was reducing the distance between the two. The adduction of the vocal cords was due to the adduction of the vocal cords was due to the lateral cricoarytenoid muscles. The lateral cricoarytenoid muscles twisting the turning the vocal cord arytenoid cartilages medially. Abduction was posterior cricoarytenoids, abducting it like this, and approximation of the arytenoid cartilages itself. They are occurring due to the